Hey there, friends! We hope you're all doing well and staying healthy. As we all know, oxygen is crucial for our bodies to function properly. It's what keeps our organs, muscles, and brain working like a well-oiled machine. But did you know that sometimes our blood might not be carrying enough oxygen to our body cells? That's where today's video comes in. We want to share with you the 5 warning signs that your blood might be low on oxygen. Now, we know that hearing about warning signs can be scary, but please don't worry. Our goal is to inform you so that you can take care of your health and well-being. By knowing the warning signs, you can take action before things get too serious. So if you've been feeling a little off lately, stick around and listen to our playful yet informative style as we go through these warning signs. Remember, it's always better to be safe than sorry when it comes to your health. So let's dive in and learn about the 5 warning signs that your blood might be low on oxygen. Shortness of breath. Let's dive a little deeper into the first warning sign on our list, shortness of breath. Now, we all know that feeling of gasping for air after a strenuous activity, like climbing a flight of stairs or going for a run. But the shortness of breath that we're talking about today is a little different. It's a persistent feeling that you just can't catch your breath, even when you're not doing anything physical. This feeling can be quite scary and uncomfortable, and it's often accompanied by other symptoms, such as coughing or wheezing. It's important to note that shortness of breath can have a variety of causes, and not all of them are related to low oxygen levels in the blood. However, if you're experiencing persistent shortness of breath, it could be a warning sign that your blood isn't getting enough oxygen. This could be due to a variety of reasons, such as lung disease, heart failure, or even COVID-19. In some cases, low oxygen levels can be life-threatening and require immediate medical attention. If you're experiencing shortness of breath along with other symptoms, such as chest pain or rapid heartbeat, it's important to seek medical attention right away. Chest pain. Now let's dive a little deeper into chest pain. As we mentioned earlier, chest pain can be a scary symptom, and it's often associated with a heart attack. However, not all chest pain means you're having a heart attack. In fact, there are many other causes of chest pain such as acid reflux, muscle strain, or even anxiety. That being said, if you're experiencing chest pain with any of the other symptoms we've talked about today, it's important to get it checked out by a medical professional. They can perform tests to determine the cause of your chest pain and whether or not it's related to your blood oxygen levels. It's also important to note that chest pain can present differently in men and women. Women in particular are more likely to experience symptoms such as shortness of breath, nausea, or back pain, rather than the typical crushing chest pain associated with a heart attack. So, if you're experiencing any kind of chest discomfort or pain, don't ignore it. It's better to err on the side of caution and get it checked out by a medical professional. Rapid heartbeat. Our third warning sign is a rapid heartbeat, and we've all experienced that pounding sensation in our chest after a good workout. But what if you're experiencing a rapid heartbeat without any physical exertion? Well, it might be time to get your blood oxygen levels checked. A rapid heartbeat, also known as tachycardia, is when your heart beats faster than normal. This can be caused by a variety of factors such as stress, anxiety, or even certain medications. But one of the most common causes of tachycardia is low blood oxygen levels. When your blood is low on oxygen, your heart has to work harder to pump the same amount of oxygen-rich blood throughout your body. This extra workload can cause your heart to beat faster in an attempt to compensate for the lack of oxygen. So, if you're experiencing a rapid heartbeat without any obvious cause, it could be a warning sign that your blood isn't getting enough oxygen. It's also important to note that a rapid heartbeat can be a symptom of a more serious condition, such as arrhythmia or heart failure. That's why it's important to get checked out by a medical professional if you're experiencing a rapid heartbeat, especially if it's accompanied by any other symptoms on this list. Dizziness. Now, let's talk about dizziness, the 4th warning sign that your blood might be low on oxygen. We all know that feeling of being lightheaded or dizzy. It's not exactly pleasant. But did you know that it could be a sign that your brain isn't getting enough oxygen? Yep, that's right. Your brain needs oxygen just as much as the rest of your body. So why does low oxygen cause dizziness? Well, when your brain isn't getting enough oxygen, it can't function properly. This can cause a range of symptoms, including dizziness, confusion, and even loss of consciousness in severe cases. Dizziness can be caused by a range of things, including low blood sugar, dehydration, and even certain medications. But if you're experiencing dizziness along with any of the other warning signs we've already talked about today, it's important to get it checked out by a medical professional. If you're feeling lightheaded or dizzy, there are a few things you can do to help alleviate the symptoms. First, sit down and put your head between your knees. This can help increase blood flow to your brain and alleviate dizziness. You can also try drinking some water or eating something to help raise your blood sugar levels. It's important to remember that dizziness can be a serious warning sign, and it's always better to err on the side of caution. If you're experiencing persistent dizziness or dizziness along with any of the other warning signs we've talked about today, don't hesitate to seek medical attention. Your doctor can help determine the underlying cause of your symptoms and provide the appropriate treatment. Confusion. Let's talk about confusion, folks. Now, we've all had those moments where we forget what we were just saying or can't seem to concentrate on the task at hand. But if you're experiencing persistent confusion, disorientation, or trouble concentrating, it could be a sign that your brain isn't getting enough oxygen. Our brains require a lot of oxygen to function properly. Without enough oxygen, our brain cells can begin to die off, which can lead to serious health issues. If you're experiencing confusion, it's important to get it checked out by a medical professional as soon as possible. Now, confusion can have many different causes, and not all of them are related to low oxygen levels in your blood. Some medications or medical conditions can cause confusion as a side effect. However, if you're experiencing confusion along with any of the other symptoms we've discussed today, it's best to err on the side of caution and get it checked out by a doctor. During your medical evaluation, your doctor may perform a test called a pulse oximetry. This test measures the oxygen saturation in your blood. It's a simple and painless test that involves a small sensor being placed on your fingertip or earlobe. If your pulse oximetry test shows that your blood oxygen levels are low, your doctor may recommend supplemental oxygen therapy. This can involve using an oxygen tank or concentrator to increase the amount of oxygen in your blood. In some cases, confusion and other symptoms of low oxygen levels can be a sign of serious medical emergency, such as a heart attack or stroke. If you're experiencing confusion along with chest pain, numbness, or weakness on one side of your body, call emergency services right away. Remember, these warning signs are just a few of the indicators that your blood might be low on oxygen. While they can be alarming, it's important to remember that they can all have other causes as well. If you're experiencing any of these symptoms, don't hesitate to reach out to a medical professional. They can help determine the root cause of your symptoms and provide appropriate treatment. Remember, it's always better to be safe than sorry, especially when it comes to your health. In conclusion, if you're experiencing any of the warning signs we discussed today, it's important to get checked out by a medical professional. Remember, these symptoms could be a sign of low oxygen levels in your blood, but they could also be indicative of other conditions. By getting a proper diagnosis, you can ensure that you receive the appropriate treatment and get back to feeling your best. Thanks for tuning in to today's video. If you found this content informative, don't forget to like and subscribe to our channel. And as always, if you have any questions or topics you'd like us to cover in future videos, let us know in the comments below. We'll see you in the next video.